Great, thank you. And thank you everyone for attending. I'm just going to press some buttons to work out how this all works. Okay. So I'm presenting on a project, it's called What Works and Why, but generally referred to as W3. My background is originally working within peer organisations, particularly within HIV, and I got really frustrated with the kinds of research that was happening that I didn't feel was particularly useful for a lot of the work we're doing. I got frustrated enough that my colleagues told me to shut up and go and do something about it. So I moved over to the dark side of academia. So what I'd like to start with, I'd like to particularly thank people with HIV and Hep C and all of their communities, particularly including people who use drugs, for the effort and the work that they've done across all the sort of types of research that's happened within the responses and within harm reduction. As a quick bit of background, I won't go into this a lot because I think some of the previous speakers have already touched on this, but peer-led responses for people who inject drugs or people who use drugs is central to any effective community-led response. Then constantly, these programs and peers themselves are constantly navigating highly stigmatised contexts around drug use and so on. But there's a limited capacity for our peer programs to demonstrate the kind of impact they're actually having. And certainly within a broader systemic approach and the kinds of issues that were raised this morning in the plenary. So the W3 project took on the challenge to try and see if we could work out a better way of articulating what peer-led programs and peer organisations are actually achieving and how we can demonstrate that kind of impact. So the W3 approach, we took what we refer to as a systems approach to developing a program theory or framework for peer-led programs to guide planning and evaluation, but also to show the planning and evaluation in a changing social and biomedical environment. What we did is we conceptualised peer-led programs as basically operating within quite a complex community, within the complex communities in which we operate, but also the complex politics and policy systems. What systems thinking brought to the research was an understanding, for example, that the way our peer communities adapt, resist, ignore, change, reorient the kinds of peer programs we're operating is actually part of the peer program and not something to be controlled or, it's something to be leveraged, not controlled or treated as some sort of confounder or disruptor to a nicely planned program. It's also the way policy and health, justice and political systems enable or constrain peer programs or abuse or empower our communities is also part of the peer work that we do. So what we did was a highly participatory approach where we worked with 10 different peer organisations in Australia, which included about 90 peer staff across 18 workshops over a couple of years. It was an incredibly privileged position to be in to actually have the resources to do something of this size. What we did was we really wanted to collaboratively work with all those organisations and the deep knowledge that the peer staff and workers had to conceptualise and I suppose bring together all those different understandings of what peer programs do and how they operate and bring all of that together. And what we did is we basically developed what we called system maps or diagram, all those kind of mental ideas of how things operate, and then from that developed a framework. We then applied that framework within a couple of organisations to see how we could make it play out. What we actually did, in the sense of when I talk about a system map, it was about going, okay, a lot of our programs are funded on the basis of recruit some peers, train the peers, peers go and do outreach, change the world. A nice sort of simple A plus B equals C kind of model. What we knew is the reality of the programs was a lot more complex than that. So what we tried to do was map out all the different influences, the politics and so forth, and we ended up with a diagram of our peer programs that looked like that. Now, you don't need to read that. But it was just a representation of that is a very different model and diagram to the way most of our peer programs are actually funded, if they're funded. What we then thought was we had what we referred to as our WTF moment, which was what's the function of within these programs. So what we actually identified was there was 4 key functions that came through, and this was really just an example of a whole range of system maps we developed. And across all of them, we found there were 4 key functions that came through, which I'm now going to describe using slightly larger font. So there were 4 functions that came through that all interacted with each other. So engagement was how the peer program engages on an ongoing basis within its communities. And it was particularly important that was the unique aspect of peers being from those communities and living day to day within those communities on an ongoing basis. That's a very different knowledge, or as we said, a very different wisdom to other people working in the environment. We also looked at, there was an aspect of alignment. It wasn't just about the peer program's engagement with community, it was also the peer organisations or peer programs' capacity to align or be part of the broader health system, political system, justice system, to know what's going on in those environments and to understand what the implications are for our communities. Then the other part is we're constantly working, as we all are, whatever discipline we're coming from, within rapidly changing environments and politically challenging ones. So learning and adaptation is really about that aspect of what we've defined as peer skill. The ability to not only have your own experience, but to understand that experience in the context of a broader community of diverse experiences, and to be able to draw on that kind of knowledge and wisdom to work out what are the changes that are needing to happen, what are the changes that are happening in the community right now that we need to deal with. And so the idea that we're constantly adapting and changing because the rest of the environment's changing. We then looked at influence, not just our influence within community, but importantly the influence within the policy, health system environments, the kinds of changes we're advocating for and our success in creating that change. What makes it particularly important, these 4 functions, I suppose the guts of it, is actually how they interact with each other. So I'm going to bring up another diagram, but it doesn't have as many lines. So this one here is basically trying to show the interaction between those functions in the different areas. So you'll see on the left there's a cloud, there's a cloud called community system. It's in a cloud because it's big, complex, messy and constantly changing. On the right, referred to as another cloud being the policy system. And by that I mean the health system, politics, media, all those other aspects that we're working, the justice system and so on. They're big, they're complex, they're constantly changing. What I'd like to do is to describe the interaction is take it through a bit of an example. We know that if peer programs are really effective, or a big part of their effectiveness is the depth of their engagement within their communities and the current challenges and issues that are happening. And that is a driving force for then a lot of the peer programs, whether it be service provision, health promotion, peer leadership. That's code for peer advocacy and trying to create change. It's just in Australia we can't often use the word advocacy. So peer leadership. And that knowledge that we have with peers working becomes a real asset for the organisation. But what's really important beyond engagement is that learning and adaptation part. That that knowledge of what's happening in our communities that we understand intrinsically actually gets shared within the broader organisation, broader peer organisation, and becomes a deeper, broader understanding of what's happening for the community and the changes that we need to make for our programs. That then leads to the kind of influence we can have on an ongoing basis within our communities. The key here is that one of the ways of identifying and evaluating is basically a cycle there. The more impact and influence we have within our communities, the more credibility the peer organisation has, so the deeper the engagement becomes. The deeper the engagement, the more influence within the community. And so if we start to break those, things start to go wrong. The other part that we identified that generally is often not recognised is the similar aspect of influence within the broader policy and health and justice system. The importance of taking that knowledge of what's happening right now in our communities and turning it into something that can be persuasive and creating an environment in which persuasive knowledge can be acted on is really key. So the idea of influencing in the policy system, and then what we referred to as alignment. The capacity to get an alignment between the types of health systems, services, policies with what the needs are of the community to create the change we're trying to do. And I don't want to simplify in any way as though achieving that alignment is a nice, simple arrow with the kind of challenges we're facing. But it does position peer organisations and peer programs in a much bigger context. What we then did was take those functions and develop what we refer to as a range of indicators and tools and practices. What I mean by indicators in this sense is identifying the kinds of things that we're wanting to measure and evaluate and demonstrate. They're the kinds of things that might go in if a peer organisation is funded, the types of things that actually go in a contract of what they're trying to achieve. We also then needed to develop ways of doing that was sustainable and realistic within small peer organisations that are, Australia, we're very fortunate. We do have funding for peer organisations, but I think I can say pretty globally that peer organisations, even if they have funding, are generally well underfunded. So it's small organisations trying to achieve large things. We then trialled and developed those over about 18 months. If I've got time, I can show you some direct examples of how we actually did that, and the kinds of tools we developed. In the sense of the W3, so what we did do is, because I've completely ignored all of my notes, what we did was work with 2 peer organisations to look at ways over an 18-month period to try and, I suppose, adapt or apply this at a whole organisation level. The kinds of outcomes we've achieved, particularly working with them to go, okay, how do we take these concepts and make them real in the day-to-day practice, was certainly we've supported the collection of much more meaningful data. So supporting the organisations to be able to collect and I suppose enhance the data they're already collecting in a way that responded to the broader role they had, not just collecting data that aligns with the funding they've received. Also increasing peer staff's confidence, but particularly capturing the unique impact that peer-led action actually takes and being able to use that within the advocacy and some of the earlier issues that came up of the ongoing vulnerability of our peer organisations or peer programs to constant criticism about demonstrating what they're achieving, and that vulnerability coupled with stigma being used against the organisations. So in closing, I suppose I wanted to highlight, in a rapidly changing landscape, we need more than timely and persuasive community insights, the things that we know are happening in our communities. That knowledge has value and needs to get into the right spaces. To recognise the peer-led organisations, if we recognise peer-led organisations as active participants and drivers within our communities and within the policy system, then that actually changes the way we think about the organisations and the evaluation that we can do to advocate for a more effective response. A lot of this, I've gone through it fairly quickly. I do have an open access paper that's available. If you go to Google and just type W3 Project and Graham Brown, it'll come up. It's a lot easier than the ridiculous title I've given it. I'd like to say particularly thank you to all of the peer organisations that were so open and honest with the project and our capacity to see all of this through. And certainly the funding from the Australian Government that allowed us to take on a project with such flexibility. I think that's it. Yep, that's it. And if there's any questions, I'm happy to show you a couple of examples. I wasn't sure how to go for time. Thank you. Also, I did bring a couple of packs with a whole lot of information in it that's up on the table.
Okay, thanks a lot, Graham. We have enough time for 1 or 2 questions, I understand. Yeah.
You use the abbreviation BBV. What is that?
I do apologise. I should be referring. So it's a blood-borne virus, so that in that context, so yeah, basically HIV and hepatitis C is the dominant aspect of, an inappropriate shorthand on a slide.
Another one?
Yep, jump back.
Becky, would you like to come to the mic again?
Thank you.
Thank you for the very interesting presentation. I'm a person who's lived family experience, and I'm part of a research project. And when we present our work, I always present, or one of us from the families present together as a researcher. I was wondering if you considered having one of the peers that you work with in this project come out and present together with you and maybe talk about their own experience. And your perspective was very interesting, but I would have loved to have heard also from some of the people who you acknowledged there in your slide. Thank you.
Yeah, absolutely. I 100% agree with that. Certainly when I present in other aspects, that's certainly the model we've done. It's always a little challenging. I mean, there are actually, I won't put them, there are a couple of people here today who've had some involvement with the project that I wasn't sure would be at the conference. But in the sense of peers, I suppose we've always ensured that I'm not a peer I don't have a strong lived experience around drug use, but within the context of this, I came from some of these organisations as a gay man and a person living with HIV, working within peer programs. But that was 15 years ago. And as a researcher, I agree with you, I don't think it's a real challenge there. Because I used to work in peer programs doesn't mean I have a lived voice experience of being a peer 15 years after being in academia. So I agree with you.
Hello, good morning everyone. My name is Sérgio Rodrigues. I'm here from Porto. I worked in the outreach team 10 years. So thank you for your presentation. And since yesterday and before yesterday, I listened a lot of people. It's good, of course, but the professionals put in the agenda the importance of your work. It's very good for us. But in the field, sometimes we know that it happens a lot of lags. For example, the peers don't receive the same money that the professionals receive. We want to see also in the projects peer to be a coordinator. We want to see also the peers to be part since the beginning to the end. And okay, I think just want to say this and thank you.
Yeah. Look, I'd like to be something I should probably highlight. One of the, I suppose, the key drivers for the project is along that line. One of the reasons we wanted to do it was to be able to demonstrate the value and the strength of peer programs and peers working environments, the full impact they're having, and that should be valued, and by that I mean valued as in paid. We're very, very strong believers that. I do have to recognise I'm from quite a privileged situation in Australia where we do have resources, not a lot, but we do have resources. The peer staff that I'm talking here were all paid peer staff. So that's a pretty privileged situation, not necessarily working full-time on that sort of thing. There's a big range. The other bit is I'd like to highlight that the W3 project, as an example to other research, is a project where the organisations and peers were all investigators on the study. They were not just collaborators and people we worked with. And you'll see in the paper, they're all co-authors. So in that sense, I suppose I'd want to highlight that peers are and should be investigators on studies, not just participants. Yep, sorry.